Welcome. I am Dr. Lori Erickson, one of the Associate Editors of Mayo Clinic Proceedings. I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has selected as Editor's Choice and highlights of the 2014 August edition of our journal. This month's Editor's Choice is Sedentary Behavior, Cardiorespiratory Fitness, Physical Activity, and Cardiometabolic Risk in Men, the Cooper Center Longitudinal Study by Dr. Shuval and colleagues from the University of Texas School of Public Health. They examined the association of sedentary behavior, physical activity, and fitness to cardiometabolic biomarkers and metabolic syndrome in a cohort of men. They found more sedentary behavior to be significantly associated with higher triglycerides, a higher triglyceride to high-density lipoprotein cholesterol ratio, a higher body mass index, waist circumference, and body fat percentage after adjusting for physical activity and covariates. When adjusting for fitness and covariates, prolonged sedentary time was only associated with a higher triglyceride to high-density lipoprotein cholesterol ratio. They concluded the relationship between prolonged sedentary time and cardiometabolic biomarkers to be markedly less pronounced when taking fitness into account. This article was accompanied by an editorial by Dr. Levine. One of this month's featured highlights is the article, Body Composition and Mortality in a Large Cohort with Preserved Ejection Fraction, Untangling the Obesity Paradox, by Dr. DeSchutter and colleagues from the University of Queensland School of Medicine, New Orleans, Louisiana, Cleveland Clinic, Florida, and Louisiana State University, Baton Rouge. They evaluated the effects of body composition as a function of lean mass index and body fat on the correlation between increasing body mass index and decreasing mortality, which is known as the obesity paradox, in a retrospective study of over 47,000 patients with preserved left ventricular ejection fraction. They found that body composition could explain the inverse J-shape of the mortality curve noted with increasing body mass index, and body fat may be protective in this cohort only if no adjustment was made for lean mass index. However, being underweight stratified by body fat appeared to be an independent risk factor. They concluded lean mass index appears to remain protective in obese patients, even when body mass index is not. The accompanying editorial, entitled To Legitimize the Contentious Obesity Paradox, was authored by Drs. Kalentar Zada, Ree, and Amin. The second featured highlight in our August 2014 issue is a special article, Medication Errors, an Overview for Clinicians. The review focus is on medication error terminology and definition, incidence, risk factors, avoidance strategies, and disclosure and legal consequences. The article is authored by Drs. Wittich, Burkle, and Lanier from Mayo Clinic, Rochester, Minnesota. The accompanying editorial, Medication Errors, What is Their Impact?, was authored by Dr. Bates and Dr. Slight from Brigham and Women's Hospital, Boston, Massachusetts, and the United Kingdom. The third featured highlight in our August 2014 issue is Idiopathic Pulmonary Fibrosis, Evolving Concepts, from Drs. Rue and colleagues from Mayo Clinic, Rochester, Minnesota. They reviewed the literature of the disease definition, pathogenesis, clinical and pathologic features, testing, and treatment of this disorder, which accounts for 20 to 30% of interstitial lung disease. Other highlighted articles in our August 2014 issue are Caveat Spectator Digital Imaging and Data Manipulation, The Consequences of Chronic Kidney Disease Mislabeling in Living Kidney Donors, Pregnancy and Postpartum Infective Endocarditis, a Systematic Review, Middle East Respiratory Syndrome, What Clinicians Need to Know, 52-year-old woman with hypotension, hypothyroidism, and hyponatremia, and Facial Hair, a newly identified modifiable risk factor in home oxygen therapy-related burns. Our series, entitled Editorial Board and Staff, this month features Dr. Robert Vassallo, who is the section editor for respiratory diseases for Mayo Clinic Proceedings. Dr. Vassallo is a consultant and associate chair of research in the Division of Pulmonary and Critical Care Medicine and associate professor of medicine at Mayo Clinic. Dr. Vasala's research interests include airway mucosal immunology, cigarette smoking-related interstitial lung diseases, and immune-mediated tissue remodeling and fibrosis development. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and other outstanding articles in the August 2014 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. You can watch videos related to our journal content on our YouTube channel. You can also follow us on Twitter and like us on Facebook to stay up to date on online first publications and on breaking news related to our journal. Direct links to our YouTube, Facebook, and Twitter presences can be found in the upper right-hand corner of our homepage. For now, I remain yours until next time.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.